Most women in the third trimester are really excited for the baby to come and maybe even hopeful that the baby might come a day or two early. But what happens when instead of starting contractions a day or two early, you feel them a month or two early? Now that's not something that you want to have happen, and this could be preterm labor. So in this video, I'm going to talk about what happens when labor starts early, who's at risk, tests available, and what your medical team can do to help. But first, my name is Diana. I'm a physician assistant. I specialize in women's health and gynecology. I'm also a mom to 4. Now, before we jump into the video, I want to give a huge shout out to our sponsor, Pink Whale. I'll talk about them in a bit, but for now, let's talk about preterm labor. Typical pregnancy lasts between 37 and 42 weeks, counting from the first day of your last period. And it's important for babies to be born full term, ideally. Preterm labor isn't actually that uncommon. It affects about 10% of pregnancies in the United States. And of these, about 80% are because their water broke or they just spontaneously went into labor. The remaining 20% are planned early deliveries because of maternal or fetal complications. Spontaneous preterm labor doesn't always lead to early birth. In fact, about 30 to 50% of women with preterm labor will actually go on to deliver at term. But if preterm labor does lead to early birth, the preterm newborn might be facing some medical challenges related to their organs not yet being fully developed. So your OB or your midwife are gonna do what they can to keep you from delivering your baby too soon. And if preterm labor does occur, there are measures that can be taken to delay birth and to reduce the risks of complications. So let's first talk about the factors that can increase a woman's chances of having preterm labor. Because even though it's difficult to predict who is going to have preterm labor, there are certain conditions and circumstances that can increase your risks. And the strongest risk factor is a previous preterm birth.
My water just broke. I think we have to go to the hospital.
What?
But even if you have had a previous preterm birth, know that most women who have had preterm birth will go on to have a full-term pregnancy in the future. Other factors that can increase the risk include being pregnant with twins or triplets or more, a history of certain treatments for abnormal pap smears, abnormalities of the uterus, uterine bleeding, and then a bunch of other conditions that I'm going to list up here too. Interestingly, studies have shown that Black women have double the incidence of preterm labor and birth compared to white women. Teenage pregnancy is also associated with a higher risk, but surprisingly, older maternal age alone is not a risk factor. On a side note, I personally have a uterine abnormality, which as I mentioned earlier, is a risk factor for preterm labor. My abnormality is called a unicornuate uterus. It means that only half of my uterus developed. I only have a uterus on my left side, which functions normally, and on my right side, it's underdeveloped. It does not connect to my right ovary, and because of this, my uterus is undersized, but despite this, I carried all my babies to full term. So this is just an example of how a risk factor does not mean that you will have preterm labor. So my unicornuate uterus didn't cause problems with preterm labor. However, it was probably the cause of my 8 years of infertility, but that is a different discussion for a different video. So what I just mentioned are all risk factors. Now we're going to talk about the causes of preterm labor, and I'm going to break them down into 4 categories. Number 1, uterine bleeding, which can be caused by conditions like placenta previa or placental abruption. Number 2 is excessive stretching of the uterus. This can occur in pregnancy with twins or triplets or more, or when there's too much amniotic fluid around the baby. The 3rd category involves bacterial infections or inflammation of the uterus that can trigger uterine contractions and increase the risk of preterm labor. And then number 4, which may be surprising, that is physical and psychological stress. So we've covered risk factors and causes, but with all that set aside, can your OB or midwife predict if you are possibly gonna go into preterm labor early? And the answer actually is yes. There are 2 tests that can be done that can be helpful in certain situations. So the first test involves measuring the length of the cervix using ultrasound. So when you're pregnant, your cervix is usually around 3.5 to 5 centimeters in length. And if your cervix starts to shorten and soften, we can detect that by ultrasound. And if your cervix length shrinks to 2.5 centimeters or less in the 2nd trimester, this is considered short and can indicate an increased risk of preterm birth. The second test involves checking for a substance called fetal fibronectin or FFN. This substance is released when the fetal membranes start to change before labor. So if its presence is high, then it suggests that you might have an increased chance of preterm birth. But if your test is low, it doesn't guarantee full-term pregnancy. Now, before I move on to what preterm labor might feel like, I just want to share my new favorite thing to give to new moms or to anybody that you want to pamper. And that comes in this little box. and it's made by Pink Whale. They make these little gift boxes that are all about pampering moms because pregnant mommies get a lot of baby gifts, diapers, baby clothes, burp cloths, which of course they need, but this is about spoiling and pampering the person who is carrying the baby because you're tired and you're hurting and you're anxious and maybe even a little bit scared. And that's what makes this a perfect gift. Let me show you a little bit about what's inside. Let's move on to symptoms of preterm labor, which can kind of be tricky because they can be similar to Braxton Hicks or false labor. And you'll want to keep in mind that Braxton Hicks contractions are normal and they don't increase your chances of having preterm birth.
She's fine. She was experiencing Braxton Hicks contractions, mild discomfort caused by contractions in the uterine wall.
Mild discomfort?
Braxton Hicks contractions usually occur less than 8 times in an hour. They don't increase in intensity and frequency, and they are not accompanied by bleeding or vaginal discharge, and they're usually relieved by resting. In the early stages of preterm labor, a woman might experience mild, irregular cramping, maybe similar to menstrual cramps, and as labor progresses, contractions usually become more painful, and then they occur more at a regular interval. Other signs and symptoms of preterm labor can include a change in your vaginal discharge, lower pelvic or back pain, menstrual-like abdominal cramps, and then of course contractions or uterine tightening, and sometimes that can be painless. And then ruptured membranes, also known as your water is breaking. So if you do experience any of those symptoms, it's important to talk to your OB, reach out to your hospital or your healthcare provider, let them know what's going on. Now let's talk about treatment because the primary goal is to delay giving birth as much as possible. This allows time for steroid injections to be given, which help the development of the baby's lungs and reduce the risk of complications. Now treatment to delay birth is typically recommended for pregnancies before 34 weeks because babies born before 34 weeks are at a higher risk of complications. However, if there are concerns about mother's or baby's health, sometimes labor is allowed to proceed. When a woman is in preterm labor, she's going to be admitted to the hospital for close monitoring. She might be given medication called tocolytics, which can be given to try to relax the uterine muscle and to stop the contraction. Steroids are also given to help speed the development of the baby's lungs. It's important to point out that the timing of the steroid is really important because the most benefit is achieved when the first dose is given at least 48 hours before birth. Finally, is there anything that can be done to prevent preterm labor? And what I would say to that is definitely avoid habits that can be harmful, like smoking and using recreational drugs. In cases where a woman has a short cervix on a second trimester ultrasound, like I mentioned earlier, she might be offered like a daily progesterone supplement or something called a cerclage, which is basically where they stitch the cervix closed.
Oh my word.
So the big takeaway from this video is make sure that you're seeing your OB or midwife on a regular basis so they can help pick up early clues that you might be having preterm labor so they can try to help you and your baby make it to full term because that's best for you and that's the best for the baby. But hey, let me know if this is something that you are concerned about in the comment section below, and also let me know what other topics that you want me to cover in future videos. Subscribe if you haven't, and if nobody has told you this today, then you need to hear this. You're incredible, you are stronger than you know, and you will be an amazing mother. Now, if you want to know even more about Braxton Hicks versus real labor contractions, I'm going to link to that right here. Click on that, and I'll see you over there.